Thank you very much, Jackie. The timing of the launch of our book is particularly fortuitous for a number of reasons. As Jackie said, it was International Women's Day last week, but there's also been a renewed focus on an increasing commitment to gender equality by the development community. And this is also reflected in the UN Commission for the Status of Women, which is happening at the moment, as well as by the Secretary of State, Justine Greening's recent speech, in which she highlighted specific areas for urgent investment needed for women and girls in the areas of choice, control and voice. At the same time, there's also a sustained focus on social protection within the development community as an important approach to poverty reduction. And it's within this context that we want to today reflect on the key points in our book regarding the progress that social protection has made in promoting women's voice, agency and empowerment, as well as to discuss the significant challenges which remain in an emerging sector such as social protection in moving beyond addressing women's practical needs towards a more transformative, gender-sensitive agenda to reducing poverty and vulnerability. So I'd like to start with some quotes from women and men that we collected during the course of our research, which we conducted in 10 countries across Latin America, Africa and Asia. First one of these, an adolescent girl in Ethiopia says, "Supporting the family is in our nature. We can't take the risk of going independent, but men don't give you enough respect if your economic situation is weak." In Peru, a married man says, "Before it was different. There were no training sessions. With juntos, the conditional caste transfer, they always tell us we must live in harmony. Before, women were not aware of their rights. Even men weren't, which is why there was violence. Now it has diminished. We talk more." And in Bangladesh, a single elderly woman says, "My daughter is married now and is facing violence in her family. If we, the women, go to the police station together, then the police will help us. These kind of issues they have taught us." So despite the range of socioeconomic and political contexts that we conducted our research in, a number of similar threads emerged from the discussions highlighted by these three quotes. And the most striking of these included the pressures that young girls and that women face in terms of family responsibilities and the limitations that that can put on women and girls' choices and opportunities. Tensions in the household over domestic and care responsibilities were also another key issue which came up time and time again. And then importantly, there was also a desire from women to enhance their skills, their knowledge, their resources, to have a better balance of power, and to be part of changing the course of their families' lives out of poverty and to collectively stand for change in the community. And importantly, what comes through our book are these perspectives of women, in particular that they're not just passive recipients of social protection benefits, but that given the right opportunities, they can be active changers at the household, individual, intra-household and community levels. Since the late 1990s, social protection has risen rapidly up the development agenda, and it's become a proven approach to reducing vulnerability and poverty. There's substantial evidence from Latin America, South Africa, India, of the demonstrated role that different social protection instruments can play, such as cash transfers or public works programs, in contributing to reducing vulnerability to household level shocks, to reducing inequality and closing the poverty gap, and increasing access to basic services such as health and education. There's been millions of pounds invested in social protection by donors and governments, and they've been invested in taking social protection programs to scale. They're currently reaching millions of poor households. However, despite emerging positive impacts of social protection around income poverty, there is increasing awareness about the limitations of social protection as a mere safety net, and questions arising about the potential of transformative social protection programming, which would become a more sustained and equitable approach to reducing poverty and vulnerability. A transformative approach would help to move the thinking of social protection beyond a focus on these narrow economic and income poverty reduction to arenas such as social and economic risks and vulnerabilities. And it would underscore the importance of social protection mechanisms to also address issues around empowerment and around equity. Unfortunately, however, with only few exceptions, this strategic features to address gender equality and women's empowerment have largely been absent from social protection programming in practice. Even when programs have addressed gender, it's tended to be in the context of this safety net approach rather than a transformative social protection agenda. And this is despite decades of evidence that we know that gender equality as an instrumental approach leads to better development and better growth outcomes. But this critical gap has manifested itself in social protection programming in a number of ways. So programs are often designed and implemented based on assumptions about women's roles in the household, which in turn reinforce their traditional responsibilities as mothers and carers at the expense of providing a more strategic opportunity for enhancing women's empowerment. Some social protection programs have also become preoccupied with the number of women enrolled in programs, such as public works programs, for example, rather than the quality of their participation. And at worst, social protection programs may have also been completely gender blind, so failing to incorporate an understanding of the different needs and experiences of men and women. For example, food subsidy programs fail to recognise life cycle nutritional vulnerabilities, such as nutritional needs during pregnancy. So to address these gender gaps, social protection must really recognise that experiences of poverty and vulnerability are multiple, they're dynamic, they're inherently influenced by gender inequality. And so social protection responses should be adequate and integrate a gender-sensitive and empowerment approach. This is particularly important, as Nicola is going to discuss in the next few slides, that we move away from these gender-blind assumptions of poverty and vulnerability at the different levels of the household, intra-household and community, and that we recognise the various components that are needed to ensure that such a gender-sensitive approach is actually taken. And here it's useful to take as a starting point the three interrelated dimensions, which is identified by Naila Kabir, which are needed to transform the nature of power relations and better enable programming to support women's empowerment. And these three dimensions, very briefly, are resources, so access to or future access to social, material, human resources. Agency, in terms of agency for women to be involved in decision-making processes, to take decisions, as well as other less measurable manifestations, such as negotiation or bargaining power. And then achievements in terms of well-being and empowerment outcomes. So these dimensions are important to consider at the different levels, at individual, intra-household, at community levels, and they also reflect what Maxine Molyneux terms practical gender needs, so meeting what women are already doing in their traditional gender roles, but also moving towards strategic gender interests which support a change in gender power relations. So I'm going to pass over to Nicola now, who's going to discuss the evidence from our book on the impacts of social protection empowerments on these related dimensions.
Great, thanks Rebecca. So turning now to think about impacts, although the development community has yet to come up with a comprehensive monitoring and evaluation tool to measure the impacts of social protection on gender relations and empowerment, evaluations have identified a range of important effects at the individual level, spanning practical and strategic gender interests. So there is, for example, strong evidence from cash transfers, public works, social pensions, food subsidies, and pro-poor insurance schemes alike that program involvement improves household consumption. And this is obviously especially important for women given their role as household managers. There's also considerable evidence about the effects of social protection in enhancing the uptake of basic education and health services, which again in many cultural contexts is considered to be women's primary responsibility. So as we well know, CCTs have a strong record here, but so do, for example, social health insurance programs, such as India's new RSBY program, which is now reaching 110 million poor people and has greatly improved family and especially women's health service uptake. A number of social protection instruments also improve women's income generating capacities, resonating with Kabir's emphasis on resources as a key dimension of empowerment. So there are nice examples from our research, including the BRAC asset transfer program in Bangladesh, which provides women with livestock and then training so that they can make a sustainable living from their animals. And then we also talk about the micro-entrepreneurship component of Mexico's subsidized childcare scheme, Estancias, which supports local women to set up creches, providing subsidized care to low-income working parents. Turning then to more strategic gender interests, in some programs, participants reported an improved sense of agency and self-confidence as a result of decreased economic dependence. So as one older woman participant in the BRAC asset transfer program noted, "God knows how happy I am for this support. For instance, if I face health problems, I can now sell a cow and use it for a treatment. I don't need to borrow money. I have 1 cow and 8 goats. I want to buy land. I told you, my hopes are big." However, at the intra-household level, the effects on gendered power relations have been more mixed. So survey evidence from Chile and Brazil found that because CCT transfers are targeted at women, there have been some positive effects on intra-household bargaining and decision-making. Well, in our work on Peru's Juntos CCT, there is evidence of reduced care work burdens for women. Here it's not the income effect which seems to be critical, but rather awareness-raising initiatives such as parenting classes attached to some of these programs, such as those in the Philippines and Peru. So as one Peruvian man reflected, "Before I would come home and grumble when dinner wasn't ready. I used to ask her what she did all day. Now I don't say that to her since I've experienced her responsibilities. I cook, wash the dishes, and do the children's laundry." Nevertheless, such transformations amongst male partners are far from universal, with changes often limited as patriarchal norms run deep. So in northern Ghana, for instance, many of the older women we talk to often handed over their transfer to their sons to manage. In other cases, program design features seek to work with gender norms rather than challenging them head-on. So in Bangladesh's asset transfer program, in recognition of the cultural mobility restrictions which many women face, program implementers meet with male relatives to explain the value of the program. So on the one hand, this is really important in terms of improving women's access to resources, but it's not necessarily overcoming key barriers to the realization of personal agency. Similarly, public works programs promote equal participation of men and women in principle, but the work is generally conceived of according to male norms. So we found in Ethiopia's PSNP, for example, that there's a strong prioritization on hard physical labor, with women being assigned so-called easy work, meaning that gender differences are in fact reinforced rather than contested. Turning next to community-level empowerment, here we found relatively weak evidence overall of positive spillover effects, although there were some exceptions. So part of the problem obviously relates to time poverty burdens and income generation pressures that Rebecca mentioned before, meaning that women often don't have the wherewithal to participate more actively in community decision-making spaces. And in part it's because incentives for change are really limited. Programs tend to be focused on changing behaviors within rather than beyond the household unit. Public works, because of their focus on the creation of community infrastructure, are somewhat different. But even in Ethiopia, where the PSNP design allows for public works labor to be utilized to build infrastructure which would reduce girls' and women's time poverty, such as water collection points, implementation has been quite poor. On a more positive note, though, several programs are seeking to tackle discriminatory norms and practices through behavioral change communication work. So again, in BRAC's asset transfer program, for example, here implementers are seeking to raise awareness about the risks of exploitative dowry practices or gender-based violence, while the LEAP CCT program in Ghana has included anti-trafficking and exploitative forms of child labor, including domestic workers, as part of the quasi-conditions the program has. Informal insurance mechanisms, whether they be community saving schemes or burial societies, are another important exception. These are premised on collective action and generally tend to be women-dominated, given women smaller and more frequent expenditure patterns, but frequent exclusion from formal financial services. And these groups, we found, serve an important social networking function, with women members in Ethiopia, for instance, emphasizing the greatest sense of connectedness they felt to their community as a result of this participation. In terms of political empowerment, participatory programming has the potential to empower citizens and strengthen state-citizen relations, but examples of good practice here were limited too in our research. So in terms of program planning, quotas to encourage women's decision-making have generally focused on numbers rather than the quality of participation, limiting their empowerment potential. Even if women do turn up to meetings, they often told us that they didn't have the confidence to speak out or believe that the program was a gift rather than an entitlement, thereby reducing the sense of ownership. And in the case of program accountability, in Ethiopia, for example, there are now provisions to support local women to avail themselves of grievance mechanisms if they feel they're being unfairly treated. And these include getting support from health extension workers to make claims, and ensuring mandatory representation of women's affairs ministry staff on grievance committees, so that a gender perspective is more routinely considered. But even so, here uptake to date has been relatively low. Lastly, in the case of participatory M&E, social audits involving community members and regular assessments of program performance hold really considerable potential to empower the grassroots. In India, however, where the NREGA Public Works Schemes has a social audit feature built into program design, our research in Madhya Pradesh state found no examples of women who had participated to date. Finally, we think it's also really important to consider efforts to promote the agency and capacities of program implementers if social protection is to be truly transformatory. Our research highlighted again and again that there's a frequent disconnect between the broader program rationale and day-to-day ways of working at the local level, and this is often exacerbated by limited attention to general program management skills. With very few exceptions, there's very limited investment of time and budget too in strengthening capacities about gender-related program features. So for example, in northern Ethiopia, public work site supervisors were often quite unaware of the many innovative design elements aimed at supporting women's involvement in the program. So flexible working hours, or support to female household heads to undertake agricultural work such as ploughing, which is often deemed culturally inappropriate for women. These were simply shrugged off as nice ideas. Moreover, we found that when gender training is provided, too often it's insufficiently tailored. There was, for example, a key complaint amongst provincial level staff in Vietnam's flagship subsidy program for the poor. An important exception, though, that we'd like to stress is the establishment of community liaison roles in cash and asset transfer programs. These have the potential to empower local women by strengthening their ability to liaise with government officials on the one hand, but also to problem solve on behalf of their communities. Where they're functioning well, such as in Peru, they help to reduce the social distance between program government staff and beneficiaries. But in contexts such as Mozambique, where the programs are quite politicized, they can also function as powerful gatekeepers, reducing the empowerment potential for local men and women. So moving forward, while we don't see that social protection can be a magic bullet for addressing all forms of gender inequality, we do think that considering the diversity of social protection instruments we cover in the book, so cash and asset transfers, pro-poor insurance, public works, and subsidy programs, that there really is considerable potential for social protection if it's underpinned with a strong gender lens to play a significantly greater role in supporting empowerment and transformation among women and girls, men and boys. And there are a number of key entry points that we discuss for achieving this. So firstly, in terms of policy and program design, empowerment needs to be an explicit program aim with both economic and social barriers to resilience taken into consideration. Implementation capacity and fiscal space is equally critical. So program staff capacities need to be supported both in general and specifically vis-a-vis gender sensitivity. and specific budget lines need to be allocated. These activities need not be expensive, but they have to be accounted for, rather than assuming they'll simply take place on borrowed time and resources. Institutional coordination and linkages are also key in light of the multidimensionality of poverty and vulnerability. So agencies mandated with gender empowerment goals need to become more central players in social protection programming, and opportunities for linkages to gender-related civil society interventions need to be mapped and then acted upon. And at the community program interface, we really need to capitalize on the potential of efforts to promote awareness and tackle discriminatory gendered social norms underpinning experiences of poverty and vulnerability. We also need to carry out rigorous assessments of their relative importance compared to economic strengthening measures, and then reflect findings in future program investments. Finally, with respect to monitoring and evaluation, there's a real need to go beyond narrow consumption-related indicators of empowerment and to develop, routinely analyze, and disseminate much more robust and multifaceted gender empowerment-related indicators. In sum then, if we put all these parts together, we think that change can be achieved with the support of tools such as this decision tree, which we developed in a related toolkit. So this provides social protection programmers with a step-by-step guide how to integrate gender through the various stages of the policy and program cycle. The ultimate aim, though, is to contribute to the realization of gender-sensitive social protection and eventually to strengthen voice, agency, and empowerment for all, so men and women, boys and girls.
Thank you very much indeed, Nicola and Rebecca.